Welcome to the Pulse of Healthcare. Dr. John McCormick here with my co-host Nick, and today, man, yeah, we're back. I don't know why we're back. We just came back.
And this is your show. I don't know. You of all people should know.
I think we were drugged into the set, and here we are.
Who drug who in the set?
I don't know. I think anyway, I drug you in, kicking it. I think I'm screaming. So, right here at the end of last month, Chris Deacon put out an article. I picked it up off of LinkedIn, and the headline kind of grabbed me before I even read the article. When the price isn't the actual price, and I went, I bet, because I know who this is. I went obviously talking about healthcare.
Oh, you know Chris Deacon?
I do. Not like close, but
You know what?
I know what.
Okay.
Know what? Met at one of the conferences. May not remember me. Anyway,
I see.
so the article starts out like a joke, right?
Yeah.
A CFO, a CEO, and a beer supplier walk into a bar.
Right.
And I thought that was pretty hilarious. And then it kind of gives you this little analogy where the beer suppliers talking about how they're going to provide their goods and services, and and they all yucking up because it sounds like a joke, right? We're going to just do some things. We're going to simplify the process. We're going to deliver when we want to deliver, and we're just going to charge you, maybe it could be today's rate. It could be an aggregate rate. It could be, and they're like, ha, 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 ha.
Now, if I'm not mistaken, the two CEOs of the CEO and CFO, are they just random CEO and CFO? Okay, they mark to the bar. They're not a scheme partnership. It's a joke. Okay, all right.
So they're supposed to represent the employer, right? The big employer.
Who have the going? But there's a bar in my. Go, guys.
So they're that's the representation, and then they go like, hey, and then he goes, and then they stop, and they're like, no, we're serious.
Yeah.
And they're like, oh, and then you dive into the article, and what's really going on here is exactly what we've talked about in this show so many times about how we have employers engaging with major insurers under self-insured platforms, primarily thinking, well, we went with one of the big names and we're getting a great deal. And what this article did is actually kind of dive into one of those carriers and extract actual contract language. And when you read it, you're like, who in their right mind would sign that? And it just becomes evident, and these contracts are not like, well, here's a 10-page contract. It's like, you need 3 lawyers and, some Alka-Seltzer and a couple of bourbons to get through them,
And a couple.
And then you got to have somebody that's an expert in the space. Does your regular business attorney doesn't even know what this means? And I've been in the space a long time. We know you're pretty new to the space.
Yes.
And I thought, this is a complex topic. And even though it's a topic that we've hit on, in the past, I thought, this is kind of worth talking about again, right? So the first example in the article is kind of telling because it says, and I'm not going to mention the carrier here, but just know it was one of the biggest ones in the nation. But the agreement defines estimated price. So in the context of commerce, right? If you were going to go into Best Buy and buy a PlayStation or something, and you look down at the tag and it said, well, your estimated price for this is $450 for this PlayStation. You would just kind of like, what?
Estimated. What are we estimating here? What's the PlayStation? Okay.
What's the price, right?
Right. Yeah.
You mean you don't know the price? You're just guessing? And yet it's directly in the contract language. And I'm just going to read it because you almost have to read it. And Chris even says, you probably have to read this a few times to understand it. But I want to read this quote. And it says, a negotiated rate of payment in effect at the time a claim is processed, reduced or increased by a percentage to take into the account certain payments negotiated with the provider and other claim and non-claim related transactions. The what?
Yeah, no, I don't know what that means.
I mean,
It's a lot of legalese.
got a doctorate. You know, I'm thinking I'm a pretty smart guy, been in the space, and I looked at this, and all I could think about is the old commercial where the lady's calling the turkey hotline, and she goes, "I'm gonna put my what in the what?" You know, that's what that reminded me of. You're gonna charge me what for what? You know, non-related claims transactions. So what are you charging me for?
I gotta keep you guessing.
I mean, back to our PlayStation analogy. And so the estimated price of the PlayStation, Mr. Nick, is $450. But at the counter, you could be charged for non-PlayStation related items that you may or may not want, but you really don't have a choice because you're going to pay up front and we're going to never tell you what else you bought.
Right. It's like, you want the PlayStation, man. I don't want you want it.
Well, I mean, you don't go there. Obviously, you committed with your eyes closed and your brain shut off to actually purchase this service or product, right? Yeah. So why wouldn't that be perfectly reasonable? Like no one in their right mind would ever do that. And yet here it is specifically spelled out in a contract, which you can almost guarantee no CFO would actually read or understand. They would just be like, it's a major carrier, so that's got to be okay. You know, which reminds me of the old court case that was about 10 years ago where a large employer, again, sued one of the large carriers. Again, happens all the time, multiple times a year, but and the ruling at the end was in favor of the carrier, not the employer. Although, if you read it, all the evidence was on the side of the employer group. But you would think, how did they lose? And the summary of the judgment was, well, you knew it was a snake when you picked it up, right? I mean, everything they did to you was in the contract. They told you they were going to rob you, steal from you, and bite you on the way out the door and not share any information. And yet you entered into business with them anyway, right? I guess we did. Well, then you lose. You know?
Lose.
So I read a little further and it goes, examples provided are not insignificant administrative items specifically. So here's some of those things you might be paying for. Anti-fraud and abuse, provider refunds. Hold on a minute. You're charging me and giving money back to the provider? What? Retrospective settlements. So we may have overpaid or underpaid, but you'll never know. But you're going to pay the price that we told you. And performance-related bonuses or incentives. Whose performance?
Who's that?
Who are you incentivizing? You've incentivized a robber to rob me. I don't get it, right? So, and then it goes on to say, yet may be totally unrelated to your plan. Are you charging me to fill up your car with gas? I mean, I literally read through this article, and it's not a short one. It's like 8 pages. I read through it like 4 times, and I literally just I had to go through it, underline some things to get my attention. I was like, oh my God, this is exactly what we've said in many different ways, distilled down into one thing with actual examples from contract language, right? So further on, it talks about average price. You remember that part of it?
Yes.
So this is where it goes. The average price methodology moves even further. The agreement defines average price. So read that for me. This is a quote right out of the contract. Average price is defined. Might be easier to read there.
It would probably be easier.
Yeah, I know. If you got better eyes than me, I couldn't read that off my phone.
Okay. A percentage of billed covered charges representing the aggregate aggregate, payments negotiated by the House Blue with all its healthcare providers for a similar classification on a provider. And they keep going.
It's just out there.
Okay.
Percentage of bill covers a percentage. So we don't know what percentage.
No. Well, they said one of them.
Some random percentage, right?
Yeah.
And this is the first representing an aggregate of payment. So not your payment. We're going to take everybody's payment and we're going to aggregate it. Maybe that means average, or we're going to go with some kind of weird formula that you and I don't get to know.
Yeah.
And then you're going to bill me that. So we're back to our PlayStation, right?
Yeah.
Well, I know we said we're going to bill you an average of $450, but we did a poll around the community, and we found out the aggregate price of that is $520.
Okay.
But so you're going to have to pay $520, although we told you it was probably $450.
But you want the PlayStation with. You want it, right?
You still wanted it, right?
Yeah.
I mean, you did sign the contract to say that we could randomly adjust the price, from time of service to the time of checkout.
Right. If you buy the PlayStation for that price that they, figure out of the blue, you're probably going to be paying for it after. You're paying for it in full and then signing up for the monthly payments afterwards.
Monthly. Well, that's the incentive, right?
Yeah.
I guess. I get your money.
It's the aggregate. Yeah.
You got to buy the same percentage. That title item, PlayStation Plus subscription.
Right. You just got to be able to play online, bit the monthly game or whatever.
I'm just trying to make this simplified for the younger audience. I'm like, holy gosh. All right. It says the amount charged to the employer on a particular claim may not reflect the economics of the provider contract tied to that claim at all. Like, what? It may reflect an aggregate payment experience across a broader population. So although your doctor may have been completely fair and said, you know what, we're going to do this procedure and it's going to cost you a smooth $1,000. When we looked across the market, we're just going to charge you $1,500. I mean, I know the doc said he's not going to charge it down, but
if he says so,
where'd that other $500 go? Because the doctor got his $1,000. So where'd the $500 go? I don't know.
Maybe the $500 it paid for like nicer tools for the $500.
I don't know.
Maybe like they put linen sheets on the bed. Oh, we don't get linen sheets on the bed.
So Chris goes on to try to say, in other words, the claim price may effectively become a blended allocation derived from a broader network-wide payment activity. Good grief.
Yeah, it is.
All right. And so the summary of all of this at the very end, it says the price is actual, estimated, or average, but it doesn't matter because whatever we tell you, that is the final price.
It's final. So set in stone.
Set in stone. That's what
Name on the dotted line.
you may be paying for what we pay. We may be just be averaging it. We may estimate it, but regardless, whatever we tell you, that's the final price.
Yeah.
And guess what? You don't get to know that. Ever. Ever. Oh my goodness. So, and then that's what it says. This is right from, there's another quote directed from the contract. The amount paid by the plan participant, in other words, you, major employer, who's picked up this snake, and contract holder, is the final price. No future price adjustments will result in increases or decreases to the pricing of past claims. Like, okay. And then goes on to say, any positive or negative differences in estimated or average pricing are accounted for through variance accounts maintained by the major carrier and incorporated in future claims prices. So we're going to randomly adjust the price, average it everywhere, and then we're going to factor that into your future payments. So you're a young guy.
Yeah. I try.
And I think you're kind of smart. I don't know why.
To a degree.
You could be Mensa. I don't know.
What?
Exactly. Mensa.
Mensa?
Mensa.
Never heard that one before.
Oh my God, that's a genius. The whole organization is a Mensa at your genius level. See, I complimented. Didn't even know he's complimented.
Didn't even know.
Better go look it up.
Over my head.
If I was averaging your Mensa against other people, then I might be able to aggregate your price. I don't know. I'm just saying. You're a pretty smart guy. If somebody was to just read those isolated quotes we pulled out of this actual contract language and said, hey, we want you to rent your apartment. Here's the contract to rent your apartment.
Yeah.
And we put in this kind of language.
Right.
Which,
With the quotes that have been highlighted, or just the entire.
no, I mean, yeah, those highlighted quotes, like, we're going to tell you what your rent is after we average the rent or we aggregate the price. But this is your possible estimated rent, but it could change. And, oh, by the way, you might be paying more than rent or less rent. But whatever rent we charge you, that's the final rent. And we can use your rent money to do other things.
Right.
Would you lease that apartment?
Probably not. I mean, it depends. It depends on how steep permanent is.
Oh, so they go right back to it, right? But it was a really nice hospital. It was beautiful, and it was represented by one of these major carriers. So therefore, I should just ignore what normal commerce would be. It just going. Just please don't rob me. And why did my rates go up 40% this year?
All right.
Maybe it was the agreement. Maybe the agreement you signed. Maybe. It's possible. It's possible.
It could be.
So back to it. When the price isn't the actual price, anytime you're dealing with one of these major carriers, employers, I beg you, hand on my knees. All right. Please read and understand your contracts. I know, because I did a whole podcast on talking to them about this. I know some of you are struggling to divorce yourself from these major carriers and these egregious practices and move to plans and TPAs and advisors that really are trying to give you transparent pricing and coverage. I get it. It's decades of conditioning. But do not allow yourself to engage in contracts where you're basically forgoing your rights to even know. You know what I'm saying?
Yeah.
What's your advice? How would you advise an employer?
How would I advise? You might be asking the wrong guy. How would I advise Mensa earlier?
So yeah.
Don't outsource your thinking. Use what you got. Use some discernment. Discernment. Use some discernment. Reading's hard, yeah, but we can do it. Just apply yourself. That's what my dad always said. Yeah.
Wise.
Just apply yourself.
Wise.
Oh, he's a wise guy, all right.
Wise. Wow. Different than me. Yeah, I got you. Well, I mean, if you're a CFO and you have a line item for $12 million, which is actually less than some of these big companies are paying for healthcare, all right, and your CFO could not define the benefit of that $12 million to the CEO or the board, you'd be fired the next day.
Yeah.
And yet, here you are in a contract that you have zero visibility on, no control of, and can't define the line item.
Just throwing money.
Why wouldn't you? They're a big name.
Yeah.
A big name that just got sued by the state of Maryland for $300 million for fraud. We'll see how that goes.
Yeah.
But, I mean, I throw that out there. That was last week. That's only a dozen lawsuits this year.
Yeah. It's large scale laundering.
Yeah, it's crazy. It's crazy. Anyway, well, that's the end of this episode of the Pulse of Healthcare. We'll be back soon with more tantalizing facts.
Yeah.
All right.
That's right. Tantalizing.
Say good night, Nick.
Good night.
Nick.